very good afternoon to all of you. This is Dr. Manisha. I'm working in Lupin Medical Affairs Division. On behalf of my team, I extend a warm welcome to all of you in this brief discussion on patient awareness program of PCOD and mental health diseases. So our team has brought together here distinguished personalities from psychiatric field to celebrate the PCOS Awareness Month in September. It's essential to spread the word about the condition and its challenges faced by women from the eminent experts like some of the experts in this field. So for that only joining with me today is Dr. Dipanwita Biswas, and she is very renowned psychiatrist. So here she will be talking about the patient awareness of importance of managing such patients affected with PCOD. Welcome, ma'am.
Thank you. So I'm Dr. Dipanwita Biswas. Currently, I'm working as a consultant psychiatrist in Kolkata. I'm really feel I extend my gratitude towards the team for organizing such a program for the awareness of PCOD and its associated conditions in this PCOD Awareness Month.
Yes, thank you, ma'am. So we are all aware that PCOD is very common condition. Generally, in Indian settings, also you can see there are many patients affected with disorders. And people who have been diagnosed with PCOS are about three times more likely to be diagnosed with anxiety and depression than people without PCOD. So these are closely interlinked with each other. So from this perspective, I would like to also understand your views how PCOS affects the women in general and how it is interlinked with mental health diseases.
So basically, PCOS is an endocrine disorder only, and it is one of the most common endocrine disorders in women of the reproductive age group. And it is basically diagnosed by the three main criteria, which is hyperandrogenism, the physical manifestations of which we see as acne, hirsutism, or male pattern baldness, that is alopecia. Another the another point is it is characterized by menstrual irregularities, which is caused due to chronic anovulation or oligoovulation. Uh, there are also ultrasonographic changes of polycystic ovaries. So, the presence of two amongst the three of them fulfills the criteria of having PCOD. Now, this is about the biological basis. Now, coming to the connection between mental health and PCOD, like there is ample evidence already available in the literature suggesting the association between the two. Uh, the effects may be due to the syndrome itself or the manifestations of the syndrome. So, PCOD basically being a state of hyperinsulinemia causes a chronic inflammatory state. And as we all know, many uh, all the chronic inflammatory states like rheumatoid arthritis, diabetes mellitus are also associated with many mental health issues, the most common being the depression and anxiety. It has also been seen that children born out of mothers who are diagnosed with PCOD are more prone to develop anxiety or depression in the later lives. Also, the medications which are used for the treatment of PCOD, like metformin, are seen to regulate and improve the mood states as well. Now, this was about how directly the syndrome itself is responsible for causing mental health issues. Now, coming to the factors which indirectly affects the mental health. These are basically the phenotypical characters, which are the acne, hirsutism, deep voice, low stature, acanthosis. These are basically very stigmatizing for the women and are a major cause of distress for the women. In fact, in many literature, PCOD has been termed as the thief of womanhood. So, this indirectly causes depression, anxiety, and a plethora of other diseases. Other features like infertility, menstrual irregularities are also a cause of major stigma and embarrassment for the woman, especially in a country like India, where woman, the major function of the woman is thought to be of bearing a child. Many of the consequences of the mental health issues indirectly also hamper the disease course of the PCOD. That is because, for example, a person having depression or anxiety will have a poor motivation to make good lifestyle choices, and thus in turn also cause hindrance in the management of the PCOD. So we have to be very careful about the interlinked connection between the two of them and manage them at the earliest. Some of the medications also which have been used in our mental health conditions and in epilepsy also, like valproate, should also be used very judiciously and cautiously in this age group, as it may cause some PCO changes in the woman. So this was about the etiopathogenesis of uh, the PCOD and mental health.
Great. So, ma'am, so if you see, there are many patients who are getting treated by gynecologists, and they are the first point of contact for them, and to understand that mental health diseases are common in PCOD. So, can you tell us, means, how we can identify the symptoms at an early age in patients who are suffering with PCOD but are inclining towards having this mental health illness?
See, what I feel is, ideally all the all the patients should be screened for mental health issues, but practically it's not possible. So the point of contact, the primary point of contact, who are the gynecologists, should be able to provide a comprehensive and holistic approach to this issue. They must identify who are at the severe end of who are at higher risk of getting these diseases, and refer them at the earliest to the psychiatrist, because it is practically not possible to send all the patient or to screen all the patient for mental health issues. uh, it is not available, like it's not practical in a scenario like India. So the first point of contact should be able to screen the patients of uh, PCOD with mental health issues.
Right. So, at the end of this session, what is your concluding remark? Just to make our viewers aware the importance of having this diseases, this illness to be treated with the help of mental health experts, apart from consultation to gynecologist.
See, I already told you how both the diseases are interlinked with each other. A person having depression and anxiety will not be very willing to make a healthy lifestyle choice, and does in fact create a vicious cycle of it. So recognizing it is very important, and it is important for the woman to feel that feel not feeling normal is okay, and no two women of PCOD are equal. So the hormonal disturbances associated with them is also not normal. One can have a very severe illness and one cannot have any. So it is not to be feel very ashamed of or feel very stigmatized of. There are answers to every problem, but the problem needs to be identified and addressed first.
Great. Very nicely said, ma'am. So, here at the end of this session, I would like to give you my heartfelt thanks for, coming here and sharing this important, valuable information with us. Thank you so much. So, here I am Dr. Manisha signing off from the session. Thank you, ma'am.